everyone. Today we are going to talk about a very important topic of oral cancer. Whenever the word cancer hits to anyone, so it's a very scary situation, I understand. But as far as oral cancers are concerned, it's absolutely preventable. So let's understand what are the measures to be taken to prevent oral cancer. Simply, we see in the society, the consumption of tobacco, whether in the smoked form or smokeless form, will put someone to the high risk of getting affected with the oral cancer. But is it preventable? The answer is yes. If you are enough aware, even though if you are consuming tobacco in any form, if you are really aware how exactly is happening, what exactly is going on in your oral cavity, and if you consult very frequently and understand what is happening, then absolutely oral cancer is preventable. As far as an oral and maxillofacial surgeons are concerned, they are excellent at diagnosing and preventing oral cancers. If you have to visit a nearby oral and maxillofacial surgeon to what exactly is happening with you if you do consume tobacco in any of the form. Generally, what we observe as an oral and maxillofacial surgeon, people who are consuming tobacco, they will have a certain type of features in their oral cavity. Either they can have a white patches or they can have a red patches, or they will have certain amount of ulcers. When we talk about white patches, absolutely you don't have to worry every point of time. It means that if there is a white patch in the oral cavity, it's not necessary it is going to be an oral cancer. But if there is a white patch, or maybe there's something happening consistently in your oral cavity, you have to consult your oral maxillofacial surgeons. Your oral maxillofacial surgeon will assess the situation in detail and will tell you what exactly it is. If you come across with a red patch in the oral cavity, that also you need to consult your oral maxillofacial surgeons at the earliest. As far as the oral ulcers are concerned, it can definitely because of the consumption of tobacco, malnutrition, or some kind of a sharp tooth in the oral cavity, or some ill-fitting dentures which is causing an irritation in the oral cavity. So these are the alarming points you should always keep into your mind if you are consuming tobacco. Of course, tobacco cessation is a very important aspect for prevention of oral cancer. In today's time, there is a lot of awareness about how to stay away from tobacco. There are a lot of medications are also available for you to stay away from consumption of tobacco, as in nicotine. So kindly take that help, and absolutely with the help of oral and maxillofacial surgeons, you can come over your habit of tobacco and you can prevent for yourself getting affected with the oral cancer. At times, a lot of people consuming tobacco or any other form of tobacco like parallel products like gutka or khaini or a lot of other products, they can get affected with oral cancers. I know when we say oral cancers, it's a very scary situation for not only for the patient but for the entire family. But with the kind of medical advancements that are available in today's time, oral cancer is absolutely curable. But when is a big question. As we know all, there are certain stages for cancers: stage 1, stage 2, stage 3 and stage 4. And as far as oral cancers are concerned, the higher the staging, more the complications that we will face. Lesser the staging will be more comfortable. If someone is very much aware, and even after getting affected with the oral cancer, if he or she comes to a clinician, especially an oral maxillofacial surgeon, that particular clinician is a very efficient clinician to understand the disease and the progress of the disease in the current stage of the disease. If you are being very aware, if you reach out to your oral and maxillofacial surgeon in nearby vicinity and you get diagnosed your oral cancer at very early stage like stage 1 and stage 2, definitely there's a very good cure rate. Of course, the traditional treatment modalities available for these stage 1 and stage 2 cancers is the surgery. But the moment a patient moves from stage 2 onwards, like stage 3 and stage 4 of cancers, then this particular disease requires a multidisciplinary approach. So it requires a surgery, it requires a radiation, and at certain point of time, for few cases, it requires a chemotherapy, that is a medical oncology help also. So depending on the stage, in today's time, with the advancement of medicine, we can definitely curtail the disease in advanced stages, and definitely we can cure the oral cancers in the early stages like stage 1 and stage 2. There can be various forms of surgeries in terms of the staging. If someone is diagnosed with the stage 1 or stage 2 surgeries, it can be very well salvaged with the help of only surgery. There won't be any big defect in terms of cutting the jaws or maybe the tongue or maybe the buccal mucosa, that's the cheek, or any other part of the oral cavity. But when the disease progresses to the stage 2 or stage 4, the surgery becomes bigger, and to salvage that particular area, we need to do a second surgery also, because we have to cover that big raw area with some other tissues also. So please understand, if you are a tobacco chewer, if you consume tobacco, or you are having some ill-fitting dentures, or there are sharp teeth in the oral cavity, please be aware. And if unfortunately you get diagnosed with oral cancers, you have to be really aware that you are at least not progressing towards the stage 3 or stage 4. So majority, take away from this particular video is, firstly, if you're a tobacco chewer, kindly try to curtail. Secondly, if you're a tobacco chewer, kindly keep seeing your clinician, especially oral maxillofacial surgeons, to keep a close watch of your oral cavity. Thirdly, if unfortunately someone has been diagnosed with oral cancers, kindly reach out to your oral maxillofacial surgeons at the earliest for the further management, so that the management of that particular disease will be in the first or second stage rather than getting into third or fourth stage, so that the patients can have a better life after the surgery and the radiation therapy. Thank you so much.